This is a study, single center study here at our center at the University of Florida. And we identified those patients by doing a slicer dicer search for all patients with the diagnosis code of ICD 36, neuromyelitis optica spectrum disorder, and try to identify all patients with aquaporin for positive NMOSD. So we identified a total of 22 Caucasian, 26 non-Caucasian, with African Americans being the majority, with 24 patients, and Hispanic with two patients. And our goal was to look at Rituximab, response to Rituximab therapy, and especially treatment failures on Rituximab therapy. So we did need at least a follow-up time of 6 months for this. So we ended up having to exclude one of our patients because they didn't have that follow-up. And then looking at our results, first of all, we saw that our non-Caucasian patients were younger at onset. So actually median age of onset was 29 versus the 48 in the Caucasian cohort. And then looking at Rituximab treatment failure, we saw that non-Caucasian patients had a more frequent failure to that therapy. So actually 6 out of the 14, which is only 2.9%, which is pretty substantial. Also kind of comparing it to, the trial data versus, just 2 out of 15, so 13% in the Caucasian group. So I think the most important thing here is that our data from clinical trials is not very representative of our population. So we really only have a fraction of non-Caucasian patients in our clinical trials. And I think there may be a difference on treatment response here. So I think what we really need to see, we need to look at these underrepresented populations. And obviously this is, a small sample size from a single center. So we need to look at bigger databases and larger populations to see if this signal that we're seeing here actually holds up. In the trial design, there may already need to be, a component of ensuring that we have an adequate representation of the population. But then also, why are our current trials, not representative? So I think we also need to develop ideas and strategies how to, reach these other patient groups to participate in such clinical trials.